Today we are celebrating a win. Just last Thursday, February 1st, the federal government tabled legislation to delay medical assistance in dying for people experiencing mental illness. Thank you to everyone who contacted their MPs and let their voices be heard to delay this expansion. Please continue to ask your MPs to support this new bill, and let's continue praying for our nation, that politicians and leaders will know that Canadians value life and we stand united to protect the most vulnerable in our society. Of course, it's important to note that in this moment of victory, and we thank God for that, the work is not yet done. We have to continue to pray and advocate. This delay in MAiD for people experiencing mental illness is only a 3-year delay. Even though our provincial health ministers are asking for an indefinite delay, signaling that most Canadians do not want MAiD for mental illness. Federal Health Minister Mark Holland, who has had his own mental health struggles, said the 3-year timeline is to get the system ready, signaling that this is still the federal government's intent to expand MAiD to those whose sole underlying condition is mental illness, and possibly even to those 18 and under after this 3-year delay is up. Recently, Executive Director of the Christian Legal Fellowship joined us here on 100 Huntley Street. And Derek Ross had this to say about how permissive Canada is on the global stage when it comes to euthanasia for its citizens.
It's only been 8 years that MAiD has been implemented in Canada. And in that time, Canada has become one of the most permissive jurisdictions in the world. The rates have increased consistently. Since 2018, it's increased by 30% year over year, the number of Canadians who have died by MAiD, 13,000 people in 2022 alone. Some of the things that set Canada apart, I think, are the fact that we do no longer have this requirement that someone's death be reasonably foreseeable. So in Oregon, for example, there's a requirement that a patient have a terminal diagnosis and that they have projected only 6 months left to live. There's no such restriction in Canada. And even if you look at jurisdictions that are more open, the Netherlands would be an example of one of the more open, permissive regimes. Even they arguably would have more strict criteria when it comes to mental illness because there a doctor has to agree with a patient that there's no reasonable alternative to their situation. In Canada, the degree of suffering is really assessed based solely by the patient. And so if there's a situation where a patient's perception of their suffering is actually impacted by, for example, their mental disorder, how does one navigate that? And so the Canadian Council of Academies that studied this issue said that unless there are additional safeguards implemented, Canada would be essentially the most, one of the, if not the most, permissive regimes in the world if they proceed with MAiD for mental illness without some of these additional criteria.
Canadians are facing a mental health crisis as 1 in 5 Canadians experience mental illness. And medical assistance in dying is not the answer. Canada's new 988 suicide prevention helpline has received approximately 1,000 calls and nearly 450 texts per day since its launch in November 2023, according to the Centre for Addiction and Mental Health. Operators say this is consistent with what they expected. I deeply believe that the work we have done to advocate against MAiD for those with mental illness in 2024 has saved lives this year. When someone struggles with mental illness, they may experience suicidal thoughts, and in those moments of suicidal fog, any desperate decision could be made, including medical assistance in dying, if the law had been expanded on March 17th. Now, we have created together with God's strength and help a window where people can keep striving to find help and continue living. MAiD expansions for those with mental illness is incredibly dangerous, as is the current MAiD allowance for those with disabilities. Here is Julia Beasley, Policy Director for the Evangelical Fellowship of Canada, on how Canada's current MAiD laws put the most vulnerable Canadians at risk.
So I think, as you said, it's really important to recognize that when that second track was created and people who weren't dying were eligible, we've already seen so many stories of people living with disability who don't want to die, but because they're experiencing housing or food insecurity because they can't afford medications or they just can't get the care and support they need to live, they're requesting MAiD. And I think it's really important we don't lose sight of that, because there's this significant group of people who are already falling through the cracks under the system we have now.
6 months ago, when 100 Huntley Street started working with various advocates who were fighting MAiD for those with mental illness, we were told that the chance of MAiD being halted for those with mental illness was not likely. And yet here is how God has moved. We're so thankful that God has moved in such a mighty way. Will you continue to pray, continue to advocate for our most vulnerable in society? 45,000 Canadians have died by MAiD since 2016, and that is the size of Charlottetown in Prince Edward Island. We have to keep our advocacy strong against MAiD. So we're going to dive deeper into this conversation on a 1-hour special on 100 Huntley Street, February 21st, 2024. This is just a delay. We want to ensure that Canadians continue to speak up and fight against the expansion of MAiD laws for mental illness and any other further expansions for those 18 years old or under. So these proposed expansions stop once and for all.